Cloud. There we go. Um, and let's go ahead and get started. So, thank you everyone so much for being here. I cannot believe it is 2026. In fact, a few days into it. I think that I was grateful for the calendar giving me a few extra days before I had to do this all hands meeting. Still coming in a little bit hot. But it's good to be back. I've been taking some time off from whole Washington. And I hope you all have had some time to yourselves or time with your family and time for the good things. But time marches on, and we got a lot coming up this year. Um, and so it's great to be back. Uh, sorry, here we go. Um, as always, these meetings are recorded. So you can go ahead and get caught up if you like by subscribing to our YouTube. And you can also just subscribe for lots of other educational content. And it's a great way to stay up with what's going on. Our last all hands meeting was in November. We just kind of had a more informal sync in December. So we've got a lot of updates that didn't necessarily get their time yet. Um, and you can go ahead and check out what's going on. Um, an introduction about whole Washington, and then we'll get into the meat of things. But uh, we are a nonprofit organization. We actually now have 501(c)(4) and 501(c)(3) status, which means that we are both a political and a charitable nonprofit, and that gives us some extra tools in the toolkit. But we're the largest universal healthcare group in Washington state. We're the authors of a proposal called the Washington Health Trust, which currently is the only universal healthcare bill in the legislature. But we're also working to build a ballot initiative campaign, and we're really the only group that's strongly backing that right now. Um, and we are also members of a coalition called Healthcare as a Human Right Washington. So we're part of a broader fabric of advocacy around the topic of healthcare in Washington. Um, a quick introduction about myself. My name is Andre Stackhouse. I'm the executive director of Whole Washington, which I've been, I think, since 2022 or 2023, something like that. Um, Still mostly on a volunteer basis. We are working to build a staff structure within Whole Washington, but I live in Seattle near Green Lake. You can get in touch with me through email. Just email Andre at wholewashington.org. I try to be good at email. I don't always get back to people as fast as I would like. So a shortcut is actually you can book a meeting with me using this cal.com booking link. And I would love to have a one-on-one with any of you. It's a great way to um, set up some time to discuss something you're working on, or if you'd just like to meet me, get a little deeper into what's going on with Whole Washington. I always love to be somebody who can help folks make those connections. And so, starting with a kind of recap of last year, we had an absolutely incredible 2025. 2025 was there was a lot of scary things happening at the start of 2025. And it was really a moment that we had to rise to meet, and I think we did a wonderful job. So, starting with some internal things, our board of directors at the beginning of the year did not look like what we have here right now. We had been for quite some time trying to get what we would refer to as a full board of directors, meaning that all of these positions are filled. Um, and the most important ones are chair, vice chair, treasurer, and secretary. So I'm very happy to report that we now have a full board of directors. We also have an assistant treasurer in Cara Karsten. So some of these are new members, and we have an assistant treasurer. So we try to make sure that we're building multiple points of support, so people don't feel that they have to take all of this on alone. And really, the only position we're still looking to fill is assistant secretary. So that's a position that anyone here who thinks they may have something to add to this board, or know somebody who they think might be a great assistant secretary, um, go ahead and uh, send in an application, and um, we would love to work on that with you. I also should add that we are always recruiting advisory board members, and so advisory positions are a smaller commitment than a voting member of the board, but have many of the same opportunities. And so we actually start all new members as advisory members and move them into these positions as we feel we are ready for that. And so uh, um, we are not going to succeed unless we have a really powerful and diverse board of directors. And I'm really happy to report that we've made some incredible progress here. Next up, fundraising update. So fundraising was a major theme of the last year, and it's going to remain a major theme over the next couple of years until we become a state with universal health care and we can put some of this behind us. And usually we give a month-to-month update on fundraising. And given that we kind of skipped December and it's a new year, I thought it would be better to just give a sort of year-end summary. So if we compare to where we were compared to 2024, we can see that um, we've had our number of individual donations grow by about 700. So in 2024, we had 878, and we're over 1,500 in the year of 2025. The average donation went up by more than $10 per donation. And you can see that it's about 35,000 more dollars that we raised across the entire year, which, by the way, is more than the entire amount that we raised in 2024. So this is significant growth. You can
Well,
see that we've always had a significant amount of our funding come from recurring donations.
on the board.
Um, and we saw about $20,000 more in terms of one-time donations, and then
I think we all
about
have.
$17,000 more in recurring donations compared to 2024. So this is really, really meaningful growth for us. We have done an incredible amount on small dollars, and we're talking about major reform to a major industry, and so we're going to have to hit some really, really big numbers. We'll talk about that a little bit more. But I just want folks to know that we are in a good place financially. We have seen some good growth. And if we continue to do our jobs right, we are going to see even more significant growth in the next year. We also have an active fundraising team that you can get involved with if that's something. It's one of the highest impact ways to contribute to Whole Washington. Um, a huge amount of this came from our first annual gala. So I'm really pleased to report that we set some big goals for ourselves with this gala. It was a huge lift for us. It was not always clear throughout the entire planning process that it was going to be a successful event. We had some incredible people step up to make it happen. Um, and if we just take a look at how we did on it, we raised over $33,000. Our expenses were less than half of that. So we netted about $17,000 in the end, which means our return on investment was over $2 for every one that went in, $2.14.
Not bad.
That is considered a successful gala. Um, and so we are working to replicate this kind of success across our fundraising events in 2026. We also have been working very hard to get our books in order and give ourselves the sort of legal and organizational status that we need to succeed. So we are a 501(c)(4) political advocacy organization, which means that we are able to do all sorts of political activities, and that's where the bulk of our donations can go to that. We are also really, really excited that this year we have added a 501(c)(3) status to our organization. And so we've done this through what's called fiscal hosting, which means that the 501(c)(3) portion of our organization is technically a subsidiary of an organization called Sustainable Seattle. But what that means is we basically get to borrow their 501(c)(3) status and do things that only 501(c)(3)s can do. And this is going to be major when it comes to strengthening our fundraising. So there's a number of things that this does, but one is that it opens us up to employer matching programs. And a lot of the large employers in Washington have employer matching programs where an individual employee can donate up to $10,000, $15,000. It depends on the employer, but they can donate that much money, and then their employer will match that much money. So those are really big numbers for us if you think back to the numbers we were talking about on the fundraising slide. It also makes us eligible for C3 grants. So there are not a lot of grants available to C4 organizations. There are quite a few more eligible for C3 organizations. And then also, or donations to 501c3s are tax deductible. Um, and so what that means is that for certain types of donors who are only interested in making tax deductible donations, and hint, those are a lot of the larger donors, they would be able to make the donation to the 501c3 portion, and write that off as a charitable donation. Last but not least, it also makes us eligible for a ton of nonprofit discounts, which may mean we have access to better software and other types of services and subscriptions and things like that that we wouldn't be able to afford as a C4, but as a C3, we can. Um, and also, I think it's just good because of how big our work is and how scrutinized we're going to be every step of the way that we are backed by directors and officers insurance via Founder Shield. And that really enables us to take on this work without worrying about taking on personal liability. And that's really going to enable us to build a strong organization. Okay, I'm going to pass it over to Thomas to talk a bit about the social media team. One of the big things is that we've built a lot of teams this year, and we've seen some really incredible growth via social media. Go ahead, Thomas.
Yeah, so we're still recruiting as we've been for a while, but check us out on social media to stay informed. I post nearly daily video content. Right now, I'm talking about the bills that we're releasing that Andre's going to talk about in, I don't know, 20 minutes or so. And we also have information and stuff like the podcast that I also released today with PNHP's Dr. Paul. Videos show up on YouTube, Facebook, and Instagram. We also have other content on Instagram and Facebook, and we're hoping to expand to TikTok again soon because we've had TikTok. It's just we don't always have people. And please follow us, subscribe, or comment on your favorite platform. Every bit helps. It's a way you can help without even joining the team or creating content yourself. Just please upvote and show love to our content and help us grow and help us reach more people.
Thank you, Thomas. Okay, so as I was saying, a major theme of the last year has been building strong teams and recruiting people into leadership positions. And so we've managed to build a comms team that meets weekly. Thomas just gave us an update from the social media team. We have a tech and data team that meets monthly, a fundraising team. The gala team is primarily focused on the gala, but we're trying to build increasing amount of sort of event planning and event coordination capacity through that team as well. And we are organizing down to the local level. We're trying to build a strong and high capacity team in every county, and you can see that we've got some really good coverage so far. So everyone should be looking to see if there are things going on close to where you live, and if there isn't, that's something that we can work with you to get going. And it doesn't have to be anything big or intimidating. It really can start with a meeting on Zoom. It can start with a happy hour or a pizza party or anything to get you going. Our goal, we have people across the state. So the goal now is to just get those people connected. Also, we have had some really, really great coalition development. So in the last year, we joined the Healthcare as a Human Right Coalition. And just towards the end of the year, we joined the coalition called Balance Our Tax Code. And these are two very important coalitions in Washington. Healthcare as a Human Right has been around since 2012 and was really instrumental in implementing a lot of the expansions to healthcare that happened under the Affordable Care Act. And they've continued to push for healthcare as a human right in our state ever since then. And it brings us into collaboration and coalition with labor unions, health boards, and tons of other organizations that are focused on this issue. There's a ton of policy expertise in here. There's a ton of legislative work that happens through this organization. And it's something that you can get involved with. This is a great place to go if you're looking to get really into the weeds and then into the details. And a lot of the stuff that's going on, I hear about first in the Healthcare as a Human Right Coalition. Balance Our Tax Code is the primary coalition that is working to build to reform Washington State's tax system. We famously have the second most regressive tax code in the country. And really, there is no universal health care in Washington without significant changes to our tax code. And so instead of going it alone and saying, here's how we pay for it, here's our taxes, here's the way we do everything, we are trying to be a part of a broader movement about tax justice in our state. And Balance Our Tax Code is the perfect partner for this. So we are a member of this coalition, and we are working with them on figuring out all of the questions around financing universal health care. We've also had some amazing endorsements in the last year, and I really wish I had all of them up here. I know that there were some really great endorsements that I haven't been able to feature on this page. But Katie Wilson endorsed us as a candidate and then won the election to be Seattle's next mayor. She was just sworn in on Friday. So that is a wonderful endorsement for us. We have never had a mayor of Seattle. We've never had an elected mayor who's endorsed us before. And so really, we are still exploring the possibilities of what we can do with that partnership. We also got our first two endorsements from labor organizations. So IBEW is an electrical workers union. And then SPIA represents Boeing employees and other aeronautics engineers. And their endorsement is specifically of the Washington Health Trust. That's a distinction that's important to them. But we really appreciate their support, and the endorsement of our policy really gives us some significant backing that shows that people don't just endorse the concept of universal health care, but they're comfortable with the way that we are proposing that we do it. And then that last one is Spokane Democratic Socialists of America. I really wish that the one that I had up here also was Democratic Socialists of America representing Southwest Washington, because they recently in December endorsed us, and they actually went beyond endorsement. They did a 2/3 majority to join us in coalition. And so their intention is to be a major coalition partner for us. And that's something that will be really relevant when we work on the ballot initiative campaign. Some of the more political accomplishments also include that this year was the Washington Health Trust's best showing. It was rewritten and improved and reintroduced at the beginning of the session. And then it was backed by the Healthcare as a Human Right Coalition. That is a photo of Representative Lisa Parsley, who really took the historic action of introducing it into the House for the first time, which means that for the first time we had the bill in the House and the Senate simultaneously. And that gave us a ton more credibility in Olympia, where for many years it kind of just languished in the Senate. And that really helped us get a record number of co-sponsors in each chamber. And so we had more support from more legislators than ever. Some of the legislators included members of the healthcare committees. Lisa Parsley is not only a member of the House Healthcare Committee, she actually was appointed to the state's Universal Healthcare Commission later in the year. So we have a powerful advocate in Representative Parsley, and we are really excited to continue this work with the legislators who have come out and shown that healthcare is a critical issue to them and they believe in universal healthcare. We also did pass our first bill ever. So it took 3 years, it took 2 versions, and it is ultimately just a resolution. But we passed Senate Joint Memorial 8004. It was a nail biter. It was the last bill heard that session. It was brought to the floor at about 11 p.m. I honestly did not think that we made it. And then my jaw dropped. They called it to the floor. And there was a bit of feisty debate on the floor. It was clear that it was going to come down to a nearly partisan vote. But in the end, only one Democrat voted against it. And we got this bill passed. And so it may be symbolic. This is basically Washington State making a symbolic commitment to universal healthcare, but symbolic progress matters. And part of it is symbolic progress for us because this shows that we do have the political clout to get a bill all the way through. We learned a lot through this process. We developed connections through this process. And so it's not so much that this bill by itself means so much. Really, what it means is it's setting us up to do more next. And so we have some new bills that we're going to be talking about this year, and they are not resolutions because we are ready to go past that. We also were invited into some very important spaces. So this is a photo from an advocates roundtable that was an event held by the Universal Healthcare Commission. We have been leaving a ton of public comments through this commission. In December, we had an amazing lineup of public comments. And this is something that we can do every month. So there is always an opportunity to give public comments through the Universal Healthcare Commission. And after this roundtable, Senator Hasegawa, who's our biggest ally in the Senate, started to call and convene universal healthcare stakeholder meetings. And so that has given us the ability to collaborate with really important stakeholders, including the Office of the Insurance Commissioner, including the Washington State Labor Council. And we have managed to develop a lot of our 2026 priorities through this. I realize now there's one other really important announcement that didn't get a slide. I totally spaced on it, but we also got a statewide resolution through the Washington State Labor Council. It is a very significant resolution. It came up through the individual labor councils and then passed statewide. And that was basically committing labor to working with us and the legislature on figuring out how we're going to move forward with universal healthcare. So a lot of these things are setting foundation and they're building our coalition. And the next step is to hold ourselves and hold our partners accountable to these bills and these resolutions. And I think that, with such an amazing year, it only made sense to kind of tie it together with a new look. And so we worked on our branding and our logo and our color theme. And it's a relatively minor refresh, and yet it does so much in order to show that growth, show this progress, and show that we are not stuck, and that we are making great progress. And so you can see we have this new logo. It says Whole Washington for Universal Healthcare. We've just cleaned up the lines to make it a bit more legible. We brought the color down to a slightly deeper red, which kind of corresponds to a red delicious apple. And then we went back through a lot of our old images and updated it with this new logo. So you can see that it's not just a new logo, it's sort of a new suite of logos and promos. And you'll see these all over our literature and website and social media in 2026. But it wasn't all of our goals that we accomplished. There are still shortcomings, and we have to acknowledge those so that we can set ourselves up for the future. And so I think the biggest thing to make sure that we keep acknowledging, because we know that people are here to win universal health care. And the reality is that the Washington Health Trust still did not pass. And it is still in many ways very stuck in the legislature. So it did not receive a public hearing. It did not receive a work session. It is unclear if the chairs will support this, or what it would take for them to support this, especially on the Senate side. We've had a challenging relationship. On the House side, we have a new chair, Dan Bernofsky. He just got through his first year. He did not give it a work session or a hearing, but we're still developing that relationship with Representative Bernofsky. And so we also, had some really impressive growth with our fundraising, but we have to hit really big numbers. We have to grow by literal orders of magnitude, 10 times, 100 times before this is all over. So we're not going to get this done on $50,000. Right now, we are really not realistically looking at passing something as significant as the Washington Health Trust, whether we're talking about a bill or whether we're talking about the ballot initiative before 2028. And so what that means is we have years ahead of us and we have a lot of work. And so it's still a marathon, not a sprint. It's still a matter of growth and persistence. And we can't get too complacent just because we've seen some promising progress. But we are already set up for a huge 2026. There is so much happening, and there is so much that is happening even just this week. So I want to start by kind of laying the context for 2026. Our state is set to lose at least $5 billion in federal healthcare funding. That's across the Affordable Care Act and Medicaid. And if that funding is not made up, and this is already happening, but the uninsured population of our state could easily double and exceed 1 million over the next year or two. The state also has a $12 billion budget deficit over the next 4 years. So if any of you get in touch with your representatives in the legislature, I guarantee you they're going to talk about the budget deficit. The attitude in Olympia in so many words is we're not talking about anything other than maintaining programs by figuring out where we're going to make cuts, where we can squeeze a little bit more revenue. And we have to fix this budget deficit before we're able to entertain anything like universal health care. We're about to start the short legislative session. So it's a 60-day session. It starts on January 12th. And it's going to be fast. It's going to be competitive. And the optimism about what is going to be able to get done is going to be very low. And we're going to be told over and over again that there isn't anything that they can do. And our job is to challenge them on that. If all of that wasn't enough, midterm elections are this November. And so there's going to be a huge amount of federal talk as well. And politics always, it goes a bit haywire when there are things going on at the federal level. But there's a lot of opportunities that come with this as well. So we have been working with those stakeholders. We have been working with those allies in the legislature. And through that, we are introducing a new suite of bills. We've got a slide for that later so you can see what they are. But it's the legislative session starting on the 12th and then for 60 days. And so if we hit hard with those 60 days, if we push very hard on these new bills, we will see what we can get. And really, every session is really setting us up for the next session. So this is the end of the 2-year cycle. We're going to see what we can get done, and then it'll be the start of a new 2-year cycle. And that's really where we can set ourselves up for a 2-year plan and really see what we can get done by 2028. So we're kind of just trying to end the session as strong as we can, but the real fight is going to be at the beginning of the next session. That's where we'll be able to talk about much bigger things and push quite a bit harder. We are building those strong local teams, as we mentioned earlier, and we were able to have some great turnout at the No Kings events. And really, the more we have going on locally, the more we're going to be seen, the more we're going to grow, the stronger we're going to be, the more we're going to be taken seriously, and the more likely we are to be able to run the initiative and succeed. So we're going to keep building those strong local teams. We're going to find things going on near you, find a way to tie in whole Washington, build partnerships with organizations that are active where you are, meet other people, and that's going to help us spread out across the state and succeed. We have some amazing new partners. I already mentioned DSA of Southwest Washington. The other one is Progressive Victory. So some amazing new partners that are really, really enthusiastic about helping us execute this plan. And with their help, we're going to be able to get quite a bit more done than we've been able to do on our own. We also have a new merch store coming very soon. I wish I could show you, but I'd rather surprise you when you can actually buy the stuff. But should be before the end of the month. So I'm hoping that by the all hands meeting next month, we will all be wearing some cool new merchandise. And we're going to hit hard with some new grassroots campaigns. And that's in addition to the bills. We'll have to talk about those a bit after the presentation. We're continuing with the gala, as you know. So one thing you can sort of save the date on now and get involved with, because again, the success of our fundraising is so critical to our ability to succeed on the issue. So May 16th, it's at the Youngstown Cultural Arts Center, and I'm very pleased that Amy Storm is the coordinator who did an amazing job in 2025 and getting a much better head start and having one gala under our belt. We are in a much better position to have an even more successful 2026 gala. But the big thing that's coming up really soon, basically now, is we're calling it Health Trust or Bust. And we are starting with January 12th. That is the first day of legislative session. And so the goal here is to build a strong in-person presence in Olympia so that we cannot be ignored. Because as I said, everybody's going to be saying we're working on it, but we can't. They're going to be saying we're trying, but it's not possible. And they don't want us to make them uncomfortable. They don't want they want us to accept the idea that everything is under control and there really isn't anything that needs to be done other than what they're already doing. And if we are going to change that and get them to do more than they are saying they are going to do, we need to build a strong and organized presence in Olympia. And so we're starting with the first day of session, January 12th. You can RSVP for it on our calendar right now. And our goal is to have an inside and an outside presence. So this is an opportunity to be loud, to be heard, and to be seen on the steps of Olympia, but also to step inside, meet with your legislator, see what can be negotiated, try to get a sense of who your legislator is and build a relationship with them. And so for us, it's very important that we start on the first day of session and that we keep this pressure up throughout the entire session. And so we're really focusing on this first day. Turnout is very, very important, but the more we can sustain it, there will be more days in person and there will be plenty of opportunities to participate online as well. And so these meetings will spill into meetings over Zoom with your legislator, with their legislative aide. And we are going to continue this conversation. It's not just to make a bunch of noise and then go home. It's to actually insert ourselves into the conversation that is happening. And what is it going to be about? Well, an overview of the bills that we are focusing on, and there are other bills that are very worthy as well, but these are the ones that we have developed with our stakeholders. These are ones that we're trying to work with our coalition on. Starting with the Washington Health Trust, it remains in the legislature, and it. I see a hand from Thomas. I guess I'll just give this overview and then pass it to him after. So the Washington Health Trust remains in the legislature. It can pick up exactly where it left off last session. But the rest of these bills are new. And I'm wondering if I maybe missed one. But the first bill, Senate Bill 5955, is about deprivatizing the state's Medicaid program known as Apple Health. And that's an avenue where we can see a lot of savings potentially. The next 5946 is an expansion to who is eligible for Apple Health. So right now, it's at about 138% of the federal poverty line, and this would expand that up to 300% of the federal poverty line. 5948 is going to put deadlines on the Universal Healthcare Commission to basically hold them accountable to what they were created to do and create a finite timeline for them to actually make recommendations on universal healthcare so that it's not just commission meetings till the end of time. a single payer trigger bill, and that basically sets Washington up to immediately implement universal health care based on certain federal actions, including new federal laws, as well as federal waivers. And then the last one is a constitutional amendment which would protect healthcare and equal access to healthcare in a similar way to how we do this for education. So it basically says the resources that the state has for healthcare need to be fairly available to all Washingtonians. So that's the overview. Thomas, did you have anything you wanted to add?
Yeah, there's a few things that are really exciting about these. The first is for Apple Health Medicaid deprivatization at the state level. That when this bill passes, within a shorter time period than a year, we will no longer have MCOs. We will no longer have insurance companies administering Medicaid. I did not know that was going to be part of that bill. That is very exciting. That's how it was written by Senator Hasagawa's staff. The other interesting thing is the constitutional amendment is actually a resolution, kind of like our previous one. And the reason this is because the constitutional amendment needs a 2/3 majority, and then it needs to go to the ballot. So it's not actually a law because it's not, when it's passed, it doesn't go into law. It needs to be approved by all Washington state residents. So just a couple details based on the bill.
Thank you. Yeah, no, a few things about some of these is that these bills were set up to have a sort of range of impact. Some of them are huge, like the health trust and deprivatization. Some of them are smaller, or they do things in the future. And part of what that does is some of these bills actually cost no money to the state. So even in a year where we don't have the budget to do some of these things, and we're going to hear all about the budget, we're able to then pivot and say, well, what about some of these proposals that don't cost money? Can you at least back that? And that then deepens the state's commitment, and it aligns us in a direction and keeps us moving towards universal health care. And I wanted to add one other thing about this, which is that if you go and look at these bills on the legislature's website, you will see that other than the health trust, which was introduced in 25, the rest of these only have one co-sponsor, and that is Senator Hasagawa. But we still have time by the end of the 12th, I believe, or maybe the end of the 13th. But basically, these bills have only just been introduced, and we still have a window in which we can get co-sponsors for them. And so that is a huge part of what we are going to be doing over the next couple of weeks, or rather next week, pretty much. We also do have the opportunity to try to get these introduced in the House. And so that creates a new window of opportunity to get a new set of co-sponsors on the other side of the legislature. So that's the overview of our legislative agenda. This is the sort of thing that we can bring to Olympia so that we're not just saying, you know, we're upset, but we're actually bringing solutions. Go ahead, Thomas.
Yeah, one of the things, it was asked in chat, which ones don't cost money? The only one that doesn't cost money right now is the resolution, the constitutional amendment. The Universal Healthcare Commission could be free if they remove the creation of committees, but because it has committees being created in it, there's a fiscal note attached to that. And the single payer trigger bill we thought was going to be a free one, but is not free because it as part of the bill, it creates a board that would then act in parallel to the Universal Healthcare Commission, creating a universal healthcare plan that would go into effect when the trigger is triggered, when the federal government does something. So right now, we only have one that's free.
Right. I mean, I think the single payer trigger bill arguably doesn't cost money at time of passage, but maybe that still needs to have its budget before they can pass it. Anyway, that's the overview of the agenda. I see a couple other hands. My intention was to pass this off so that we could look at some of the things coming up and then cut to questions. So maybe let's do that now. Amanda, did you want me to switch to the actual website, or can you work with this slide?
I can just work with that slide. I have a list right here of events that I want to talk about. So the biggest one is, as Andre mentioned, the January 12th rally the first day of the legislative session. You want to show up and be there. And we have 2 events this week to kind of prepare for that. So the first one is tomorrow in Shoreline. We are making signs at a volunteer's house. So RSVP, and then I can send you the address directly. That's tomorrow at 6 p.m. And then we are having a kind of talking to legislators / their assistants training on Saturday, January 10th at 10 a.m. And that will be recorded. Also happening tomorrow is the legislative preview. That is at the University of Puget Sound in Tacoma. You can go to the calendar to get a ticket for that. It's free, but you do have to register in advance. That is tomorrow at 6:30. And then also on Saturday morning is the Thurston County in-person meetup in Lacey. That is also at 10 a.m. And then Spokane has a bunch of events this month. The first 2 are this week. The first being the Greater Valley Support Network presentation. That is this Thursday, the 8th at 9 a.m. And the second is a screening of Healing Us on Friday, the 9th at 6:30. And you can check the calendar for the location and all of the rest of the amazing events that are coming up. But that's what I had.
Thank you so much, Amanda. So I think that's pretty much the material that I prepared for this. We have some other things that I think will also be relevant, but maybe we'll try to organize that a bit better before we take it to you. But if you go to the campaigns section of the website and you go there, we have the Patients Over Profits Pledge and the local resolutions. And those are 2 campaigns that we'll probably be focusing on quite a bit in 2026, but may be secondary until after the legislative session is over. So with that said, I'd love to use the time we have for questions and discussion. And I will go ahead and stop the recording now so folks don't have to worry about being on YouTube.